Documenting progress is documenting success. Today we're going to talk about re-exams on Perinatal and Pediatric Conversations, the podcast of the PPA. I'm Dr. Jessica Taglerini.
I'm Dr. Linda Slack.
And I'm Dr. Ashley Emmel. And the question of today is, how do you measure success and how do you measure progress in your practice when it comes to your patients? So I think it's a really hot topic of how do you measure that? What do you guys do? What do you do to measure success with your patients?
Well, we do re-exams, but we have to do a proper re-exam. And we teach this because most people don't do an exam where they can follow up and have objective measures to be able to determine success.
Mm-hmm. Which I personally find really interesting that so many people in our profession don't set themselves up for that. So a re-exam, technically, I think the definition should be done, every 12 patient visits?
That's what I do for adults, yeah.
Yeah.
Linda, what do you do for
I would
kids?
say every 12 patient visits or 1 month, every month.
Fair? Okay.
And for me in practice, sometimes that reevaluation, it should always be done kind of on those measurements, the 12 or 30. But sometimes you have a patient where you say, it's an interesting circumstance, or you're looking for something else, so you're coming back maybe at visit 6 or visit 8 or visit 4 and saying, in this amount of times we're going to do a re-exam, so that way if we need to pivot from our plan or we do some type of a care plan, we have measurements to go off of.
Absolutely. It's on a case-by-case basis in some cases. Yeah,
Yeah.
absolutely. So the reason we do re-exams is we want to celebrate successes. We want to measure those goals, or we're going to measure the goals we've reached and just really embrace that. Sometimes it's goals we set that we meet, and sometimes it's unexpected goals, and those are a lot of fun, you know. We want to be able to refer if appropriate, either refer out or bring in another member of a healthcare team to work together with those patients, and modify care if needed. And that could mean technique, giving them things for home, and that kind of thing as well.
And the opposite, sometimes we're not getting the results that we expect, and we need to do a re-exam to reassess and see if we need to do something different, add in something different, or refer out.
Yeah, and I see too, so think about it too, sometimes we're taught, sometimes when they come to a chiropractor, we're not even on that list of places they're going, we're on the sticky note next to the list. How many people have heard that? I think that's been instilled, which we're really not that anymore. We're really not on the sticky note. But for some really hard cases, when it comes to maybe tethered tissues with Dr. Linda, or pelvic floor with myself, or perinatal with Dr. Jessica, they have been to providers that have not worked, and some of those are a little bit gun shy of is this plan going to work? Is what you're doing going to be helpful? So those specific patients, I might come back and be like, you know what, at visit 6, we're actually going to do a re-exam. So don't worry, every time you come in, I'm going to measure and see how things are going. I'm going to ask you questions. Of course, you're going to check in maybe with our iPad on your subjective part, but I want a measurable outcome of where are we at this type of the plan.
Yeah. In our courses, we teach you how to ask the right questions on day 1 to set goals appropriately, not just around symptom relief, but around how their symptoms are affecting their lives. And it's interesting, when you get to the re-exam, sometimes when you ask them how certain things are doing, they forgot all about those things. There's things that are better, that have been better so early on in their care plan, that they completely forgot they had that symptom, or that, that thing that was making their everyday life difficult. And that really is pretty cool. Oh my gosh, I forgot all about those headaches. It was a side note to them, but they were getting them 4 times a week, for example, and that wasn't even their main complaint, but it's bonus, and I really love that.
So Dr. Jessica, when you're seeing your patients, right, whether it's a parent or a child, what do you charge, or do you charge for a re-exam?
I do. I think chiropractors have a hard time. We always say we're here to serve, and so sometimes we feel guilt about charging, but honestly, there's no other profession that doesn't charge for the services they do. It's kind of a funny example, but if you go up to McDonald's and you order a cheeseburger, they're going to charge you for the cheeseburger. It's not free, even if they like you. You really need to charge for what you're doing. A couple of reasons. First of all, it establishes value, but also you want those charges in your ledger because it shows that you follow that standard of care, especially even if they're a cash patient. Because did you ever have a cash patient and then months later an attorney for a case you didn't even know was going on request records, Or if they're like, oh my gosh, I had insurance through my spouse all along and I didn't know, and they want to go back and bill those visits to the insurance and you didn't document that, that's really, really important. So it's important to document it in the ledger, include those charges, even if it's an insurance company that doesn't pay for re-exams, to show that you did that and follow that standard of care. One thing that all of us do is we include that fee in our initial, so when we set the initial expectations with the patient. We've talked about other podcasts how we talk about what to expect clinically, but we also talk to them about what to expect financially. I don't know about you guys, but I don't like financial surprises, you know? So that dollar amount is rolled into the initial cost. And I think that's important, to get paid for what you do. We deserve to get paid for what we do. Everyone else gets paid for what they do. You know, through the pandemic, the cost of everything has gone up. So, I mean, we should not feel guilty about that. And please, you know, if you are feeling guilty about charging for things and charging for re-exams, call us, talk to us, take our course, and we can help coach you through that.
And with re-exams, like if we're not charging, it's really important actually to do exactly what you said, for like setting those expectations and letting the patient know exactly what the costs are. It's part of the No Surprise Act that is, you know, they're not really following it yet, but they will be. So we need to let our patients know what the costs will be for the care. No surprises in the end.
And it's a really great point. So I don't like gray area. My office staff and my team know that. We talk about it daily. Like, we don't do gray, we do black and white. So no surprises has been in effect for what, a year and a half at this point. And so basically that says that anything that could not be covered by insurance, or the patient might be self-paying, you have to let them know what those fees are above. So it should be in your new patient paperwork. It should be part of your care plan. You should document and sign that they acknowledge that you told them what things were going to cost, so they can't come back later and say, I didn't know. But on that same note, it's that value. So going to a re-exam, just like they said, like, you couldn't go to McDonald's. Well, you're not going to go to your dentist. You're not going to go to your PT. You're sure not going to go to your ortho. None of those. You're not going to be admitted into the hospital for a birth. They're going to itemize every single thing they did. I think about like an Advil charge, $20 in the ER for one Advil. So think about all of those things and bring value without overcharging, because you also want to make sure the patient has value with what you're doing. So we're not saying like charge $500 per visit. No. But if you're kind of at that standard of, if you're with insurance, does insurance cover it or not? Maybe they don't. Maybe you're a network and it's just a universal fee. That's what it is. But if you are on wellness or self-pay, you need to charge for those. We're not saying you have to charge $100 for a re-exam, but you do need to charge for that re-exam, because you're establishing care and you're getting them to their end goal.
And people expect their insurance to cover less and less these days, you know. I remember when I first started in practice, people were like, well, I want to use my insurance. I pay good money for this. And now people realize premiums are up, deductibles are up, co-pays are up. Their insurance is covering less and less. It's covering catastrophic things and less wellness things. And people expect to have to pay somewhat out of pocket. And so that's okay. It really is okay.
But it is just as wrong and can get you into trouble legally to not charge or to charge too much, whether you're charging too much or not charging at all. If for any reason there was a legal issue that came up where a parent needed records, like you said, with if they, maybe there was an accident involved and an attorney was looking for those records later on, if you didn't charge for it, you're going to get in trouble just as much as if you overcharge and overutilize.
Yeah, absolutely. And documentation is key too. We're saying, so make sure you charge for what you're worth, but document everything, because you should be taking notes. Like, you take notes every time. You document exactly what you did, how long you did it for, what they were on, whether it's their adjustment, a re-exam, x-rays, a therapy. You document all of that. Do not get lazy with your notes. Document it, because just as we've said like 4 times now, at any time those notes could be requested for any reason, and you need to not only charge for what you're worth, but document for your worth.
And also remember, with a pediatric visit, we usually spend way more time and do more service for that pediatric patient. So you need to charge for those services as well.
That's a great point. Dr. Linda, before I took your course, it didn't even dawn on me to charge for pediatric re-exams or even do pediatric re-exams. And so could you talk a little bit more about pediatric progress exams?
Yeah. So in our class, we teach a very thorough pediatric exam so that you can show the findings to the parent, good and bad,
Mhm.
and then you have measures to be able to see the success or not, lack of,
Yeah.
and to justify future care.
Yeah, and sometimes the initial complaint by the progress exam might not show improvement, but you might show improvement in a bunch of other things they didn't realize, like posture, range of motion, certain orthopedic tests or neurological tests. So a lot of times we see progress in that re-exam objectively before subjectively, and it helps reassure them why they should keep going, and then they get to the next re-exam and then those subjective things are better then too. So it really helps lay that groundwork.
Yeah, and I think like going on that note too of things subjectively, but you never know down the road. So like, especially if you're in pediatrics or pregnancy, there may be actually an issue later on that another provider is going to need those notes for. I have an example of a baby that has very low tone, has had low tone since I saw baby like initial visit. However, I had seen both the brothers as well, and also low tone that turned out just fine. But this baby specifically, mom kind of got frustrated with me. She's like, well, why didn't you notice this? And I was like, I've only seen baby one other time. You didn't come in for several months, and now you're wanting body work for tether tissue revision. And you're, like, asking, like, well, why didn't you? I've seen baby once. I can say I saw baby once. This at 2 weeks old is what I saw, which is much different than a 3, 4, 5 month old when it comes to tone. So having those notes and documenting and then being able to do a re-exam on those future visits is really important.
Yeah, absolutely. Well, thank you for joining us today. So please follow us on Facebook at Perinatal and Pediatric Academy.
And follow us on our website at perinatal-and-pediatric-academy.com, hosted by Ellis Bennis with Floating Axe Technologies.
And we look forward to seeing you on our next podcast.
My remote's